In early 2020, we knew a pandemic could impact our community. Howard County General Hospital's leadership team began preparing for the worst, initiating our emergency response after the first cases in the U.S. crept closer. Our first COVID-19 positive patient arrived on March 13th. Everything as we knew it was about to change. I'm Dr. Shafeeq Ahmed, and I led our hospital's response to the pandemic. As businesses began shuttering their doors to the public across the country, we knew our community would be relying on our doors being open to care for them now more than ever. Our amazing team went to work preparing our hospital as well as themselves. It was daunting and scary for all of us. There was so much that we didn't know and a constant ongoing stream of new information that resulted in daily and sometimes hourly changes as to how we cared for patients. Personal protective equipment was in extremely high demand, but fortunately, we were prepared with sufficient inventory, equipment, and conservation plans. Our physical hospital spaces had to change completely to isolate patients with COVID-19 safely. We had to take care of all patients, COVID positive or not, in a whole new way. Being part of a health system like Johns Hopkins Medicine has never been more important to this community. Our local infectious disease experts were able to collaborate with some of the best experts and researchers in the world. New discoveries and learning from Johns Hopkins had an instant impact in Howard County. We also worked very closely with our health department, government, and emergency services personnel who were all instrumental in supporting the hospital. We focused on keeping our staff and patients safe. We offered many meals and support resources to the doctors, nurses, and staff who worked nonstop to care for our community. In the first year of the pandemic, we treated thousands of patients with COVID-19 and expanded our testing capability to meet the high demand in our hospital and community, all the while delivering our normal volume of babies and safely caring for patients who needed hospital care or surgery. 1 year later, I want to thank and recognize our incredible clinical, operational, and administrative staff for their perseverance and resilience. And I want to thank our community for their constant support. The pandemic has touched each and every one of us. We have lost members of our community, friends, and family. We have shown strength. We have kept the faith. We have worked together as a team to care for all of our patients. We have proudly served our community for more than 45 years, and while this past year challenged us in many ways, we stand strong and committed to continue to care for our community.